Welcome back. The U.S. Food and Drug Administration plans now to put a black box warning on COVID-19 vaccines. Now, it wasn't immediately clear whether the warning for COVID-19 vaccines would be applied only to mRNA vaccines, mRNA vaccines, I should say, or to all COVID-19 vaccines, or whether they'd apply to all age groups. Now, black box warnings appear at the top of prescribing information for medicines, some of them anyway, and it's the FDA's most serious warning, intended really to warn about risks like death or life-threatening or even disabling reactions that should be weighed against the benefits. Now, the plan has not been finalized just yet and may still change, but it is expected to be unveiled, we're told anyway, by the end of the year. Also, more changes are coming from the Food and Drug Administration tonight. Officials are moving to get rid of those warning labels on other medications as well. In fact, just last month, the administration announced it would be removing black box labels on hormone replacement therapy, often used, of course, to treat menopause symptoms for aging women. So joining me on the couch today, and I think this is a really timely topic here, is the medical director of Advanced Vitality, Dr. John Mendelsohn, as well as Katie Vincent, who is an advanced practice registered nurse. That's a mouthful, right? Thanks for being here. And I feel like we have a lot to get through, because I know as an aging woman, it's something that I've wondered about, and I know a lot of my girlfriends have when it comes to using hormone replacement therapy. So let's talk about this here. For 2 decades, those labels warned about serious risks like, of course, breast cancer, heart attacks, as well as stroke. So why do you think the FDA, Dr. Mendelsohn, I'll start with you, is removing these labels?
Sure. As we were just discussing, that Women's Health Initiative was a large study of 160,000+ women, mostly aged, the cohort was age 50 to 79. And so many of those women had already perhaps developed plaques in their cardiovascular system. And so the increased incidence of some of those strokes and cardiovascular accidents were placed on all of those women, and now we know that that's not accurate. Estrogen can actually be cardioprotective. There are many, many benefits that we find, particularly starting at an appropriate age. There are still certain patients who shouldn't go on it. We can talk about that. Age-wise, this isn't exactly, but you want to be within that window of 10 years from menopause, okay? And so starting after that still carries some risk, but selectively, if a woman enters menopause later, perhaps at 65 years old. So everything is individual.
Katie, I want to bring you into the conversation. You deal, I'm sure, with women who are looking into hormone replacement therapy. And what do you think about this change from the FDA?
I think it's going to improve access altogether, and it's also going to remove some of that pause that women might have. I think it'll give them more, confidence in the fact that this is a great measure to help them feel better and help them thrive through menopause.
I think that's always the big thing when I'm talking with a lot of my girlfriends about menopause, and we hate to even say the word, it's like the M word in our group. People really are afraid of hormone replacement. And what would you say to those people?
I would say work with a provider that's willing to look at the entire picture, and because really a lot of these risks that we see with hormone replacement therapy are from imbalances. So if you have estrogen therapy without any progesterone on board, then you are at a higher risk of developing certain things. So we want to make sure that you're in balance and that we're providing those therapies appropriately.
Quickly, before we wrap, Dr. Mendelsohn, you mentioned there are some people who maybe this is not for and should not consider it. I'm guessing if you're maybe predisposed to breast cancer or other cancers, is that what we're talking about?
Yeah, you had mentioned breast cancer, and you really want to be careful that you're not feeding a tumor, so estrogen receptor positive. There are, and we talked about age, so history is certainly important. And as we evaluate patients, we want to make sure we're not looking just at their symptoms, but we're looking at their labs. And I will say another thing, we're talking about vitality. There are many women who also might use testosterone, and sometimes that's a little bit taboo, but it's certainly in terms of increasing libido, cognitive function, cardiovascular health. So there are a lot of benefits to hormone replacement, but it's not for everybody.
Yeah, and I swear, I say it all the time. I don't know how our grandmothers and mothers did it before we had all of these things that are at least one more tool in the toolbox. Guys, thanks so much. I feel like we could do a whole 30-minute segment on this. Dr. Mendelsohn, as well as Katie Vincent, thanks guys so much for being here from Advanced Vitality. Appreciate it. All right, in the meantime, are you worried about the snow that we're getting tomorrow? we're really going to get it tomorrow. Here's Allison Rogers with more on what's moving in. I know, Allison, a lot of people woke up this morning and